Thank you very much, Dr. Henry. And first of all, I want to start by expressing my condolences for the families of the 11 people, 8 in Fraser Health and 3 in Vancouver Coastal Health, who passed away in the last 24 hours from COVID-19. We are thinking of you today, of the grief you must feel, and of the challenge that this virus presents for everyone, for family members, for friends, for caregivers, for communities, especially those communities who are dealing with outbreaks in long-term care, where people are most vulnerable to this virus. And so it's for them, and in thinking of them, that we're asking everybody today to think this weekend and to act this weekend in ways that will stop the transmission of COVID-19. I wanted to note, as Dr. Henry has noted, the 301 people currently hospitalized with COVID-19, the 69 in critical care. We have continued to have adequate capacity in our acute care sector, 71.5% occupancy if you count the base beds and the surge beds. In acute care overall, 55.6% of capacity filled in critical care. But as everyone knows, the challenge is not just having the bed capacity, but having adequate staff and resources to deal with the situation. We do for the moment, but it is important, I think, for everyone to understand how critical it is for everybody, for those waiting for other procedures and for everyone, that we do everything we can to stop the spread. Over the last number of days as well, I've had the occasion to meet with a number of religious leaders and communities virtually, and to participate yesterday in my own church in some religious study yesterday virtually. And I just want to express my appreciation to religious leaders, faith leaders around British Columbia for their leadership, because I want you to know how much of a sacrifice we know it is not to have in-person services this weekend, whatever day those services would take place on, whatever faith, that it's important. And generally speaking, those kind of activities, whether it be those activities or other cultural activities, are a way we measure health in our community. So we understand that. But it is necessary with the current state of the pandemic in British Columbia to follow the orders that Dr. Henry put in place 8 days ago. And until December 7th, that means no in-person services, religious services. And I want to say that I've had, I think, very positive discussions with leaders of faith around the province, understanding ones. And I understand the sacrifice that everyone is going to, but we need it now. And it's that leadership we've seen from throughout the province that will help us deal in this most difficult of times with the challenges that we have with the transmission of COVID-19. So I want to thank them. I want to again remind people of the need, especially this weekend, to take every step to stop the transmission of COVID-19. You know, this is the kind of time of year. Dr. Henry and I did our, I think, first briefing after our first case of COVID-19 about 10 months ago, a little over 10 months ago. It's hard to believe it's been that long. And we know, and I understand, that people would like a break. But right now, that's not possible. I understand that the month of December, where this is the last weekend of November, is important to many people. It's a year, it's often a time of celebration and holiday, of course, for children over the winter break, and a celebration of Christmas and Hanukkah and other religious celebrations that are of critical importance to people. But right now, this Christmas, we have to, I think of ways. And the orders are in place on December 7th, and we'll have more to say about that next week, but think of ways that we can celebrate together, that we can make this Christmas of 2020, at the end of this year of 2020, this year of pandemic and other things that have come to, that our society and our country has had to face and our world has had to face, that we can have a special celebration that allows us, with the people that we are in our household, to celebrate a true spirit of the season, whether it's Christmas or other occasion, that will be memorable, I think, in a time when surely such celebrations will help us all. And to remember that physical distancing saves lives. This weekend, it's important to remember that wearing a non-medical mask in indoor public spaces saves lives, and it's a provincial order as well. That staying home when we're sick saves lives. That washing our hands saves lives. That coughing and sneezing into our sleeve saves lives. That avoiding non-essential travel saves lives. And for now, we save lives by socializing only with those in our household. And if we live alone with only the one or two people we've seen regularly all along. It's a time when we're starting to see in our communities Christmas lights on our houses, our balconies, and our storefronts in our neighborhood. And for the next little while, let these lights also serve to remind us that in stopping the spread of COVID-19, the work of each of us, every one of us, matters. Let them remind us, those lights remind us, that we're not alone in our efforts. Friends, neighbors, and people we've never met are doing the same work that we are doing. And in this, let's find seasonal joy and comfort in knowing that on our own and by working together, we can make the most important difference this year, stopping the spread and saving lives of those we love and of those we don't know. Aujourd'hui, nous annonçons des nouveaux cas de COVID-19 en Colombie-Britannique, 911. Nous sommes attristés d'annoncer 11 nouveaux décès liés au COVID-19 pour un total de 395 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 301 personnes sont actuellement hospitalisées, dont 69 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.